My name is Andrew Brouwer, and I am from the University of Michigan Department of Epidemiology. My colleagues at the School of Public Health and the Michigan Department of Health and Human Services and I were interested in better understanding the outbreak of hepatitis in our state. Across the country, more than 33,000 cases of hepatitis A have been reported since 2016. Michigan was one of the first states to report an outbreak, with nearly 1,000 cases between 2016 and 2018. Although hepatitis A has largely been considered a foodborne pathogen, these more recent outbreaks have been driven by person-to-person transmission and have been associated with people who use drugs, people experiencing unstable housing or homelessness, and those who are or were recently incarcerated or institutionalized, among other groups. My colleagues and I used surveillance and vaccination data to fit an infectious disease model to determine how vaccine timing and coverage influence the spatiotemporal patterns of the outbreak, distinguishing between the core Southeast Michigan outbreak and outbreaks in the rest of the state. We found the vaccination campaign may have been too late to have had a substantial impact in Southeast Michigan, but that it had a large impact on the rest of the state, preventing an outbreak lasting several more years. In this analysis, we were limited by not knowing how many people were at risk for infection or whether reporting varied over space and time. We also do not have molecular or contact tracing that would be needed to characterize the spread of the virus through subpopulations. Our findings emphasize the importance of proactive rather than reactive vaccination strategies. Interventions are much less effective once transmission is sustained in a community, so vaccinating before an outbreak starts will be most effective. Our work also emphasizes the importance of targeting high-risk groups in urban centers who can seed new epidemics by traveling to other areas. Ultimately, we hope that this work will help to prevent new spread of hepatitis A and to encourage proactive public health interventions more generally. Public health can be taken for granted precisely because it is so effective, so it is important to translate these lessons into continued action. Thank you.